kind of dive right in.
Great.
So what is it that initially inspired you to specialize in spine surgery?
Literally, one night in the emergency room, I was looking at an x-ray of somebody's neck, and the bones were just off by maybe 3/8 of an inch, and yet the man was paralyzed. I can't remember if it was a car accident or he'd fallen from a height, and it just amazed me that a little misplacement like that could completely incapacitate somebody, whereas the rest of my orthopedic training was otherwise pretty brutal. I mean, it was gunshot wounds, car accidents, heavy trauma, so we would have bones sticking out of the skin, we would have pelvises sheared in half, but this seemed so minute, it just amazed me that somebody could then be completely paralyzed. And so there was a technique we were using back in the time, and this is before MRIs, where we would actually physically manipulate somebody's neck back into place. And then I was the first generation of what's now called spinal surgeons, where they combine orthopedics, neurosurgery, and neurology into one package. I remember going to Mexico with a very talented surgeon there by the name of Eduardo Luque. He actually came up to Cleveland, and so I had that kind of exposure to what were the pioneers, the big thinkers, and that's been my contribution, has then been able to teach others, because at many years, Baylor University, I taught many nurses, technicians, and physicians the techniques that I've been taught.
Okay. Now, how has spine surgery evolved in the years since you began practicing? I know we talked a little bit earlier about some of the evolution that you saw in hardware, but how else has it changed from what you've seen?
It used to be every Fridays we changed body casts, because after surgery, everybody got a body cast or some form of that. And so rarely do we do body casts now. I haven't put on in 6 or 7 years. And even now, we don't use many braces. So you can think of the hardware, the screws and the rods, as internal braces. So the external bracing is gone because it's being replaced by the internal bracing.